Sophia, do you want me to get started?
Yes, I was just about to introduce you. So, hi everyone. Thank you so much for joining our Pennsylvania Public Health Association lunchtime webinar series. I am really excited to welcome Ruth McDermott-Levy from the Mid-Atlantic Center for Children's Health and Environment at Villanova University. And I'm going to turn it over to her to kind of kick it off and get started. Thanks, everyone. And we'll have time for questions at the end.
Great. Thank you so much, Sophia, and thank you for inviting me. And also thank you all for coming here. The weather's so gorgeous out, it is hard to spend this time inside. So maybe you're sitting on the porch or somewhere listening in. I am really happy to share with you all the work of MACHI, the Mid-Atlantic Center for Children's Health and the Environment, which is a pediatric environmental health specialty unit. And I will explain that to you in a moment. Now, let me see, why isn't why aren't my slides advancing here? There we go. We are part of a national network of 10 PEHSUs, or Pediatric Environmental Health Specialty Units. And we match up with HHS, so the Department of Health and Human Services, 10 regions across the United States. So we are region 3, which again matches up with, ATSDR, which is part of CDC, and the EPA. And so we work with those folks quite a bit as well. We are a group of health professionals with expertise in climate change and health. I happen to be a nurse, but within our network, we have certainly pediatricians, toxicologists, pulmonologists, public health professionals that, again, have expertise in environmental health. And there, okay. So our region is region 3, as you all know, which comprises Pennsylvania, and you can see it's a big portion of our region, West Virginia, Delaware, Maryland, and the District of Columbia. And so we service those areas with all the activities I'm going to explain to you that we work on. We go by the acronym MACHI, which is the Mid-Atlantic Center for Children's Health and the Environment, or PEHSU Region 3. So we're called both things. And we are located at Villanova University. We had been at Georgetown, and we still have our co-director, Laura Andrico, is still in the DC area. And so we have representation again across the region. But our office is at Villanova University in the College of Nursing. And you can see on this slide, and Sophia does have the slides, and I'm happy to share them with you, our phone number and our email address. So if you have any follow-up questions or concerns, or if we can support any of the work you're doing, we are happy to do that. We are federally funded. Oh, you know what, I skipped. That's my problem with the slides. I skipped the first 2 slides. We are federally funded, and we're funded by the CDC through ATSDR, which is the Agency for Toxic Substance Disease Registry. And that is, again, our nation's leading toxicologist. So we have really great resources there. And then the EPA does fund some of our work as well. And because of that, our services are free to you all. And again, we encourage you to use us, whatever way is helpful for you in your work, or if you're teaching. We come into classrooms, we do all kinds of stuff. Our particular PEHSU is, we are nurse-led. There's only 2 nurse-led PEHSUs in the network. It's us and Emory. And so we are kind of nurse heavy in our work, but that doesn't mean we can't meet your needs. We are nurses that come from a background and a lens of public health. We are all about prevention and looking at ways to reduce risk for children and their families. And so our particular PEHSU has nurses, nurse practitioners, a nurse midwife, and then we also have consultants who are physicians and toxicologists. And as I said, being part of this network, we often will reach out to one another for different people's expertise to help us, because we really are a national program but we are divided by these networks because by these 10 regions, because there are unique things about our region that would not apply to the Pacific Northwest or the Southwest. So we're making sure we're addressing the needs of our region. So why do we even have a PEHSU? Well, that is an important question, and it's one that certainly the government asks a lot, and we give them really good answers to continue our work. But in the 1990s, there were two medical events that demonstrated the need for expertise in environmental health for children. And that was an episode in New Jersey where actually it was an old thermometer factory that became a childcare center, and children were coming down with these unusual symptoms, and the physicians who treated them in the 1990s, we didn't have as many nurse practitioners or PAs, so they saw primarily physicians. They didn't recognize that this was an environmental exposure. And so that was kind of a red flag of, oops, we need to make sure our healthcare providers are knowledgeable in that. And the other one was when homes were illegally sprayed with an insecticide, methylparathion, that again, people were coming down with these unusual symptoms, and the physicians did not include in the history or even in assessing and going over, asking the patient about different exposures. That never came up. And so it takes much longer to identify a risk and to remove that risk from people. When I also say healthcare providers, public health professionals are included in that group of healthcare providers, because as I said, we come with a public health lens, and we have many public health professionals in our network as well. So also to highlight the importance of this, and these are 1997 dollars, so we can only imagine it's in many billions dollars more, but there are 4 environmentally associated diseases, of course, asthma, cancer, lead poisoning, and then neurodevelopmental disorders. And you can see from this slide, in 1997, it cost $54 billion. And so, not only are we talking about human life, we're talking about and human potential, we're talking about cost too. And sometimes you have to use those numbers to get people's attention. The uniqueness of children is really important for us all to keep in mind. And I'm going to have many slides about this, but one of the things with kids and those of us who have worked with children or have had our own children or live with children or is their dietary patterns. They tend to eat the same thing. They get in kind of these food jags, so they'll only my youngest son only ate one specific type of macaroni and cheese. That was it. And so, if he's eating that every day, and if there's, some sort of toxin in there, that can cause a problem for the child. And so they are much more susceptible to toxicities because of their size, because of, their eating patterns, because of the way they breathe, their frequency of breathing, and their bodies are still developing. So there's a window of vulnerability. And then also thinking, for us adults, if we start when they're young exposed to things, and then through a lifetime, we can have cumulative impacts. And so again, it's really important that we kind of hit the ground running with addressing the needs of children right out of the gate, right when they're born. And actually, this is the reason then that the PEHSU was developed. So as I said, in the early 90s, they started looking at, wait a minute, there's a problem with our healthcare providers not being able to address environmental concerns. And then, so finally, towards the end of that decade, in 1998, there was an order created to create the PEHSU network. And so we started in 1998 to address, again, environmental exposures for children. I want to also pause here. We are not poison control. So if there is an acute exposure and the child is acutely ill, then we recommend that they go to either the emergency department or call poison control. And again, it depends, if the child is really having a tough time breathing, they need to go to the emergency department, and then they may call poison control. But we don't take care of those acute things. We take care of the kind of those long-term exposures where people are noticing something odd. They're the things that we take care of. But we do work closely with poison control. And actually 8 of our PEHSUs do have they kind of share offices. They share personnel. We don't in Region 3, but we do work closely with our poison control colleagues. So the goals of what we do is we educate, we do consultations, referrals, and outreach. So today would be an education of sharing what we do, and also sharing who we are. And I'm going to go into some of the environmental things. And those of you as public health people know it is vast. And then we also do consultations. So people will call us, either health professionals will call us for concerns. So we often get calls from pediatricians, or we can get calls from family members for concerns. Yesterday, I was walking through a lady that it sounds like, although we need to investigate a little bit more, it sounds like she had some inferior building construction done that exposed the family to some paint that's problematic, and a few other things that are problematic and causing health problems for the family. So that would be a consultation. We also, as I said, talk to pediatricians. Often we get calls with elevated blood lead levels and how to manage that and how to address the issues for the family. And we will make referrals. This lady that I was talking about with her home issue, I more than likely will be referring her to a law clinic to help her, get money back for poor workmanship and to be in a healthier environment. And so sometimes we think beyond the kind of the environmental science and think of some of the social issues. And again, as public health people, you all know that those social issues can be just as important. And so that would be, again, examples of referrals. We'll make referral to poison control. Sometimes also we'll make referrals to environmental health physicians. There aren't many of them, but we do have a list of them in our region. And then outreach, we will, if something comes up like COVID, and I'm going to get into the environmental health impacts with that, we will reach out to groups and say, there's an issue going on. Do you want us to come in and help you with that? So, and it does help to be part of a national network because we do share a lot. So overall, our mission then is to improve children's health and reproductive health. And so, we have expanded. So the value of a midwife, working with women before they have children or during their pregnancy. And fortunately, we also are getting wiser when we talk about reproductive health and understanding that the male's health needs to be good too, to have a healthy child. So we do have a broader perspective. And again, certainly children from birth to 18 years old. These are our clients and the people we work with. This mission was adapted for PEHSUs about 18 months ago. And we have, again, evolved thinking about the historical injustices that have occurred and how we can address that and the racism that has occurred related to environmental justice or environmental injustice. I'll give you examples of some of our programming there. So again, there is a reminder, those of you who have taken anatomy and physiology, those of you who have taken environmental health courses have probably seen this, that there is a window of vulnerability during the developing fetus lifespan of, while the baby is developing, that if mom is exposed to certain things, it can cause problems with the child. And again, we want healthy children for a healthy future. And so once we have the living, breathing child, other things that are really important to think about, and often I'll hear people say, children just aren't little adults. And I think that oversimplifies it. And so I try to stay away from that. but it is important to remember that we're looking at a developing being, and we often can see the social development of a child. Kids that, the 2-year-old that has a temper tantrum versus, the 14 or 16-year-old that may not be making the best choices. But their bodies are still physically developing. And so, thinking about environmental exposures, that can cause a real problem. Our lungs continue to develop after birth, and so they grow with the child. They get bigger. The alveoli, those air sacs, continue to develop through 2 years old, and then the lungs continue to develop into the second decade of life. And so, again, thinking about, uh, cigarette smoke exposure, poor air quality, what that can do to the developing lungs. And so, that's really important. In addition, kids play really close to the floor. And so thinking about dust that they could be breathing in, they breathe more rapidly. And so, again, lung problems can be a real issue if we don't look at the environment. Their brain and central nervous system continue to develop. Their immune system is still developing. And so that can, the body's natural ability to fight things is problematic for the younger child. And as they grow, their immune system gets stronger. Their gut or their gastrointestinal system can absorb more toxicants than we can, because again, that's still developing. And then, children have very little control over their environment. So they're counting on us to make good decisions for them. And if we have healthy children, we can have healthier adults. And, I know I'm preaching to the choir about the importance of that for a community and economically as well. So what I'm going to do really quickly is kind of go over some examples of our consultations. These are composites. These are not one single consultation, and I'm not telling you what state they're from. I just kind of shared a few things that we're doing to give you a sense of what we do. And again, thinking about how we can support your work. So a child, we had a call from a mother, and actually this mom happened to be a nurse, that she took her children for preschool lead testing, and her 3-year-old had an elevated level. They, for those of you who don't follow lead testing, they just reduced the action level maybe a year, maybe that was 18 months ago too, a year or two ago, to 3.5 nanograms per deciliter, which is yay, because we all know there is no safe lead level. So, we're gradually, hopefully getting it to 0. So her child had a 4. So she was above the action level. And her 8-year-old lived in the same house. This was done in the summer. So they'd both been in the house for a long period of time together, had 0.8. So he's low. And so when we go through and talk to families about, tell me about your home situation, tell me about how old your home is, water, all kinds of things we go through with the family. And we found out that this was an 85-year-old home that had renovations. So that was kind of the first thing that concerned us. And they weren't taking their shoes off, because we can track dust in, and that can be problematic too. But as I said, this mom was a nurse and was not going to sit still for anything that could hurt her children. So she went out and got one of those lead testing where you can, those wipes where you can wipe things. And it turned out her child's toy came back as high lead levels. And we do see that with some plastic toys, older plastic toys, and some imported plastic toys. And this actually happened to be a very expensive leading brand of a toy. So again, we worked through those issues with the family of, removing that, and again, thinking about how can we protect the child. As a reminder for those of you who don't work in children lead prevention, a diet high in calcium and iron can reduce the binding of the lead, so that's good. So it can be excreted through, when they have a bowel movement, it can be excreted. That's good. We want to get it out. Good hand washing to keep the toys clean. And then also wet wiping surfaces. So that's kind of the basic things. And then we went over, we do offer resources. So we went over, what resources might be available for follow-up. And as you can see in Pennsylvania, we have that lead-free promise project. And then also looking to the county or state health department. And then of course, the PEHSUs are there to support that as well. Just looking at our state, this is from 2020, the childhood lead surveillance report. And these are the 10 major municipalities in Pennsylvania. What I think is so telling about this, first of all, they used the 5 at that time, which is right. But then now that it's 3.5, we know then the rates would be higher if we looked at it today. But the other thing is, and I have it highlighted, is Reading, Lancaster, and York City, which are more rural towns, and certainly their surrounding areas. I've been to these places, I do know their towns, and but the surrounding area is very rural. And so, oftentimes, and I'm from the suburbs of Philadelphia, so I can attest to this, but oftentimes we think of Philadelphia as problematic. And yes, Philadelphia has many problems. And then we think of Pittsburgh. So we think of the 2 big urban centers of our state, but we can't forget the center of our state and our more rural areas. And I think this is a reminder that we need to think about that too. Think about housing stock, think about the population that lives there. And I know these are things that you, as public health professionals, we always think about. But the other unique thing for rural Pennsylvania is that many people rely on hunting or fishing for their food, and depending on economically where we are, I would imagine more people, again with the inflation, may be relying on more caught things for their protein source. So thinking about the sinkers for fishing are often lead, although there are steel and other sinkers that are available. And so the dust from that or the lead can get on your hands. I remember years ago when I did fish with my kids, my hands would get black from the lead sinkers. And so, again, hand to mouth type of things that people aren't really aware of that risk can be problematic. And then hunted meats can be a problem. I'm told by people that have eat hunted meats that the bullet actually chars out, and so you get these little flecks of bullet. You can get that in your meat, and so essentially people could be ingesting lead. In Pennsylvania, there are regulations that you can't use a lead bullet for fowl. So birds and things you can't hunt with a lead bullet, but we still can do it with deer and rabbit and other things that people may be hunting. And so that's an area where we need to really advocate for people that there's safer alternatives for them, and that people can afford too. So again, for those of us who address the needs of rural Pennsylvanians, that's something for us to think about. In Pennsylvania, we do have the Pennsylvania One Health Committee, and they've been really active in this area of lead exposure. So not only to hunted meats, but then also livestock like cows and I don't know if we have goats in the state. I imagine we do. Again, I'm a suburban girl, but I do know I'm on this committee. I know what primarily they do talk about cows, that lead paint. So if there's lead paint in barns and things, just like children, it is sweet, and so cows like to chew on it, and so that can be a problem. Again, if we've got cow meat, and people are eating that livestock. And then it's also a problem for the farmer too, because that can interfere with their economics. So these are things that the Pennsylvania One Health Committee is working on. And they are working on a very comprehensive white paper that should be out, I would guess, in a couple months, looking at all those different sources of exposure for humans and animals. For those of you who aren't aware of One Health, it's really kind of a very ecological perspective of environmental exposure. So it looks at the concerns of our animals, both wild animals and livestock, our plant life and healthy people. And so there's people from the Department of Agriculture on this committee, people from veterinary medicine, and then of course, public health and human health. So it's an active group addressing the needs for our state. So I did mention that we were busy during COVID-19, and when they first said, we need to ramp up, we've got a lot of money from the government to address COVID-19, and I'm like, well, where are we with the environment on that? And it surprised me that it was right to cleaning products, but I guess it shouldn't surprise us because people were looking for answers and they went right to the objects that we could possibly be transmitting COVID-19. And we have come to learn and acknowledge that it is an air quality issue too. So those are the things that we worked on. So initially we worked on safer choices for cleaning products, and we continue to do that. We all know that people, more is better. And that's really not the case, especially when we're talking about children in these environments with some of these really toxic products. So the EPA put out some really great guidelines that we supported and helped people kind of make good choices. And so there was a list from the EPA of approved products that's still available that would address COVID-19, but be as least toxic as possible. We also wanted to, this was actually a great lesson for me, to be perfectly honest. I knew you're supposed to read labels, but I needed to be reminded because we all get busy. And also a little kind of personal note, when all these webinars came up, I thought, I should have my husband listen too, because we live in the same house and I want him to do good, safe things. And so now he's the one that reminds me, you need to do this first. So it's always good to have a partner keeping you honest. But certainly we worked with childcare centers and the importance of, what is it you hope to accomplish and what are the risks for children. So the importance of pre-cleaning before you use these products and making sure that they read the label and leave it on as long as they're supposed to, those sort of things. And as I said, we're still addressing this. We had a consult a couple of weeks ago of a child in a nursery school. The nursery school was using so much bleach, which is really toxic, that the child would come home smelling of bleach. So, we helped the family, and then we also worked with the nursery school to help them have a safe environment that was, reducing the risks of pathogens, but then also not making people sick with the products they were using. So again, these were the really basic instructions that we worked with teachers and childcare providers on making sure, again, they're following the directions, keeping things out of reach of children, and not having children be responsible for cleaning the area. And that, because some schools immediately said, well, we'll just have the children clean their table, and children shouldn't be working with these chemicals. So, again, we all need a reminder of, wait a minute, what is it we're doing? And then we also got into adequate ventilation as we learned more about COVID. And this continues. So in a sense, COVID was absolutely awful, and we will all agree to that. But in a sense, it made us look at what we're doing in our schools and childcare centers, and not giving up now that COVID is kind of stepping back a little bit. I don't want to say going away, but continuing to address these issues, because as we know, this isn't the only health problem that occurs indoors. So as I said, we worked very closely with teachers, and that actually was kind of fun, and child care workers, and we've continued to do that. Another thing, again, thinking about, COVID made us change practices. And so there's an opportunity in this to address indoor air quality, which most Americans spend 90% of their time indoors, and indoor air quality tends to be 2 to 5 times more polluted than our outdoor air quality. And in Pennsylvania, our children have a lifetime asthma prevalence of over 12%. It's higher in Philadelphia, it's 21%. Again, the urban environment can be a problem. So, you know, this is an opportunity for us to keep working with places where children congregate and help try to keep them as safe as possible. Again, thinking of the environmental justice issues, uh, uh, in Pennsylvania, it's a 1-to-9 ratio of children with asthma for white children, but for Black children and Hispanic children, it's 1-to-6. So 1-to-9, I personally think is too high. 1-to-6 is awful. And so we need to work to make, again, things better for the children. And when we do that, we actually are making things better for everyone. So when I think about some of the work I do, I really think it's very family focused. And, so we're making it a better environment for the parents and maybe the grandparents too. That's not a bad thing. So these are the things that we still work with childcare providers and teachers with. Opportunities to improve indoor ventilation. There should be at least 4 exchanges every hour. And so one of the things we also worked with the childcare providers is work with your facilities people, work with your maintenance crew. And what I've found when I've done that is they're really happy that we're interested too. So it's really a team approach, and it is an opportunity again to look at what we're doing in our schools to keep everybody healthy. And then these are just the ranges of what we need to do as far as air quality. So that's there for your reference. And again, we don't, depending on where you are, you do or don't need to wear a mask, whatever the requirements are. But there is opportunity to continue this to improve ventilation for our children and our teachers. The other thing we do when we worked with childcare providers is we talked about carbon monoxide and the importance of where the sources of carbon monoxide from burning fuels such as wood, gas, or oil. Then that's an opportunity to talk about other options for keeping your place warm or cool. And so kind of touching on climate change a little bit. As we know, these are all interrelated things, but again, thinking about how to improve air quality for children where they gather. One of the things that I constantly just shake my head over, and my own children experience this, is school buses would idle in front of the school, and then all you could smell was the exhaust in the lobby of the school. And so by educating the providers and the teachers, they can advocate for a healthier environment for the school. And if principals want to come to our sessions, we're always happy about that too. So any opportunities, again, because if we can keep that air quality in the school improved, we help the staff, everybody who's in the school. So it's all positive. We get a lot of calls about mold. And the first thing I do is I tell people that mold needs food and water. So let's look at what is the food. Mold's not picky. It will pretty much eat anything. You can see it's happy here on the paint or the drywall. But the moisture is the big one. So we go over, where the moisture might be coming from and how to reduce that. One of the things that, again, this is often when we pull in law clinics that are really willing to help on this, because it's also an opportunity that we use law clinics from different law schools in our region. And so the faculty is really happy to give students environmental education in law, but there's quite a few unscrupulous landlords, as I'm sure you've all experienced, advocating for clients that can be really challenging for people, and especially low-income people that don't have the resources. So we do spend a lot of time on those social issues to get people in safe environments, and we do, that's what we do, is try to reduce the risk. We don't do the, if it comes to any kind of suits, that is not what we do. So I will refer them again to help our clients. So we get a lot of a lot of mold calls. And then along the lines of indoor air quality, and then this is kind of outdoor air quality, is we also have the flags for the air quality flag program. And this is related to the EPA's, green through red or purple um, way of monitoring or acknowledging our air quality. And so it was originally designed to put them on the school flagpole. So, they go up and put up the flag for the American flag, and then they can also put the flag for the air quality, and to inform parents of that, informs whoever's dropping off the children, or even the children themselves, depending on their age, of air quality related to management of asthma. But there, as we this program has evolved, but as this program evolved, there's no reason why this can't go at any public place, like a library, like a place of worship, anywhere to alert people of the air quality. And, I mentioned climate change. With our changing climate, we are going to see more bad air quality days, and we have seen that across the Commonwealth. So, this is a great opportunity. Any opportunity to educate, I always think is great. And then my next hope, we don't do policy things, but we educate policymakers. But those of you who do, any chance to advocate for, strengthening policy to protect people, can come out of the education. And I think these flags are one way to do that. PFAS, I hope you've heard about in the news. It is the forever chemicals that are out there. It is a very, very complex and complicated issue. There are over 12,000 PFAS-related compounds. So more than likely, if we were all tested, we have been exposed in some way. And I'll go over quickly what the areas of exposure are. But these are chemically stable. It's the carbon fluorine bond that doesn't break down. And so even out in the environment, it lasts forever, and it remains in the body for a long time. Causes a variety of things. There's a recent National Academy of Science, Engineering and Medicine report that I'm going to talk about in a minute, but it identified, kind of without a doubt, kind of levels of understanding about these complex chemicals. It is responsible for high cholesterol. It can cause altered immune response, and so that's why we may see some vaccination kind of resistance, and it also can cause small children, low birth weight children, and kidney cancer. So they are the clear ones, and then there's some other areas where we're like not, we're suspect. We're thinking that PFAS may be causing problems in there. So you can see the bold areas they're clear that that's causing a problem. And this is from the European Environmental Agency. So it is a problem around the world. And so it's being addressed many places. But so we want to try to reduce the risk as much as possible. So where does it come from? So it is a man-made chemical. And so we see it in a lot of products that we use. So nonstick cookware, if you have that, you may want to think about replacing it. Certainly if there's cracks in it, or from using utensils on it, if it's scraped, you definitely want to discard it. A coating on paper or cardboard food wrappers, stain resistant furniture and carpets, water repellent clothing, and so it goes on and on and on, down to Nordic ski wax can even contain it. And so it's also in firefighting foam. So people that worked in the military, firefighters, and then people who worked in industry that made this product are also at occupational exposure. So we can be exposed, and then we can also be concerned about occupational exposures for people. It gets into the natural environment, and then we can ingest it. So we can get it into waterways, and then it can contaminate the fish. Also, snow is the same issue. Certainly air, so we can breathe it in. And then it has even been found, this was a study in North Carolina, it was noted in pine needles. So the plants absorb it. I am not a forester or a tree expert or even, a plant, somebody who studies plants. And so this needs to be investigated more of, then do we need to worry about like gardens or agriculture in areas where PFAS is a higher problem than it is in others. So what happens is it gets up into the air a lot, like we see with most contamination pathways, is it gets up in the air and then can come down in the rain and then get into our water tables, and then, as I said, the plant life. And so in some communities, they have had PFAS in their water, and that can be very problematic for people. So that's exposure pathways. As I said, drinking the water, it can be in the food depending on exposure, again with fish, and if livestock are eating or drinking the water, that can be a problem. We can inhale it. It is not as readily absorbed by skin. So, if you bathe in water that may have some, I'm not saying bathe in PFAS, but some water that may have some PFAS in it, that is not the biggest problem. And but it also can get into the dust in the home. So these are things that sound kind of similar, to reducing lead exposure, of keeping, moist dusting and mopping of the home, taking shoes off, those kind of things are very similar. So they're good practices for everybody to do. One of the best ways within the home is through filtration. And so that can be a real problem for low-income communities, because reverse osmosis is very expensive. Granulated activated carbon filters can be expensive. Although the prices are coming down, I was just looking at them. They're about $200 to $300 for an under the sink one. But then you might need to have somebody put that in. But that is expensive for many families. It's cheaper than purchasing their own water. But, so there are things that we need to think about, again, thinking about issues of justice. But these are just reminders of knowing where PFAS may be and thinking about how we can reduce the risk for families. And related to children, I mean, just thinking about if carpets are treated with PFAS, and thinking about all the time children spend on the floor. The real quick one is good choices in cookware. Get rid of that nonstick cookware. My favorite is the cast iron. I love that I can buy my cookware at my local hardware store. And when you cook with that, first of all, it cooks really evenly. When you cook with that, you get a little bit of iron, so that's good. But stainless steel is also a good alternative. There is a regulation in Pennsylvania regarding safe PFAS levels, except I just checked. It was introduced back in March, I believe, or no, it was introduced in the spring, because the comment period was up till April 27th. So I'm not sure where that's going through the General Assembly, but that's something to keep an eye on and try to support that. As I said, the National Academy had just put out this report in August, and our co-director, Laura Anderco, was one of the authors. So we do have expertise. If this is something you'd like to follow up on, we have expertise right in our own PEHSU. We will be having an ECHO program, which is a 6-session, 1-hour session program on PFAS, and you're all invited to come if you're interested in doing that. The first one starts October 5th, and I need to apologize. We just found out today. Well, it was my mistake. We had to change the date, and we just put in October 5th. And then when I looked at the calendar today, I realized it was Yom Kippur. So I apologize to people who that may be a problem for, but it will be recorded. It is the introduction one, and so we're stuck with that date. It's the problem. So, but if if you can't make the 5th, you can get the recording and still join the session. So my email's at the end of this slide thing, and I would love for you to join us if you're able to. And again, it's a 12 noon session. We continually work on environmental justice, especially related to children. And I'm sure that's not a new term for you all. So I'm going to just skip ahead to what we're doing. Before I do get into that, those of you who are interested in this area and have communities that you're working with, I recommend looking at EJ Screen to see the possible exposures, and it overlaps exposures, risk of exposures based on the community with social factors, age, ethnicity, the community income level. And so you can really see, targeting populations that you may be addressing. And there's just an example, but, and they also have, because it is, like, all these different layers, it's kind of challenging to figure out, but they do have videos on how to use EJ Screen. So I just wanted to call a shout out because I use it a lot. What we're doing is we have found that a lot of the environmental health expertise in the public health and healthcare realm tend not to represent the communities that are most impacted. And so we're really doing some outreach with some community colleges and some HBCUs that have nursing programs, and working with their faculty to educate future nurses so they can address these issues. And then we're also working with underrepresented communities such as Latino, Native American, low-income urban organizations, and immigrant and refugee groups, and then also Head Start groups. So we're really trying to address those who are most impacted, and also trying to really give them voice in these issues. And so in addition to our ECHO program, we also are going to have some single webinars in October for Children's National Health Month. And here are the dates for those. The first one will be recorded. It is a recording of a previous program. And then the others are specifically reproductive health, neonatal environmental health, and then lead exposures and management. So you all would be invited to that. If you're interested in coming, we would certainly welcome you. So I tend to talk a lot. I'm sorry, it's life of a faculty member. But I would be happy to entertain any questions or comments.
Thank you so much, Bruce, for that wonderful presentation. So as you mentioned, we do have roughly 10 or so minutes left for questions. Please feel free to unmute yourself or use the hand raising function on Zoom. Thank you.
Hello.
Hi, Alexander.
Hi. I have a question. Do you give third-party access to some of the data that you collect?
That's a good question. You know what, we actually don't do research. We use the research to guide. We don't really collect data. Let me say this, the National PEHSU Network does collect data, but it's more of how many people did you see, like how many consultations did you do related to lead? And I don't know if they break it down by region, or state, but if you email me, I can find out for you.
Okay.
Okay, but research is not what we do. We rely on the research to, use the best evidence to help people.
Okay, thank you.
Mm-hmm.
Hi, Dr. Ruth.
Hello.
Hi, I'm a public health dental hygienist with the Philadelphia Department of Public Health. I was wondering if you could share the link for the PFAS wheel that you had the chart as far as those products. I saw dental floss on there, and I am super curious, and I want to do some more research on my own as far as the FQHC I work in and product recommendations. I don't know if you're able to share, or maybe I can email you.
Yeah, I can. I will see if I can find it. I usually keep the links in there. I will see if I can find it for you, but yes, dental floss, depending on the dental floss, that some of those plastics have PFAS.
Thank you for sharing.
Thanks for bringing that up. Any other questions or comments?
I had a quick question. I'm sorry. I've looked at some of, my name is Hannah Covert. I work for the University of Pittsburgh, but I work remotely, so I'm based here in Philly, in their environmental health department. We're looking at PFAS, and is that report that you mentioned from the National Academy is a good one to try to figure out what exactly are some of the health effects? Because it seems like we're not really sure yet with PFAS.
Right. So it is the most recent one that my colleague, as I said, was an author, so I feel like I lived with her through it. They did a deep dive on the most recent research,
Okay.
and then they've ranked it of, yes, we're sure this is causing health. This one we're not, it looks like there's some evidence in this one. So, and that actually is in the summary of the document. And I'm sure you know that you can just Google it and you can get the whole document for free because it's from the National Academy.
Yeah, I've used some of their other things. Yeah.
But the focus of that report was really for healthcare providers and how to consult and address patients who think they may have exposures and what laboratory tests to do. So, but it is the most recent and comprehensive. So I would recommend looking at it, for kind of the rank of, okay, we think this is it, because they really, it is quite an impressive group of people who looked at this.
Okay, that's a good place to start. Thank you.
Yeah, it is a good place to start. Any other questions? And, if there's any way that you see intersections of the work that you do, again, we're happy to share, we're happy to collaborate. We have partners across the region.
Okay, if there's no other questions, we can close out. I did record the session and it will be up on the Pennsylvania Public Health Association YouTube probably later today. So if you know anyone who wanted to listen but couldn't make it, please make sure to let them know. The next webinar will be October 26th. I think it's a Wednesday from 12 to 1. The title, we're still trying to figure out who's going to be presenting, but that'll be released soon. All right. Thank you, everyone.
Thank you, Sophia.
Have a good rest of your day.